welcome to our talk, Usable Security for Machine Learning Systems in Mental Health, a Framework. This is Helen presenting on behalf of both myself and my collaborator Erwen at Designing AI in Support of Good Mental Health workshop at KDD 2020. More about us at the end of this talk later, but before we get there, you will have walked away with heightened awareness for this very complex but overlooked issue in machine learning systems built and used in mental health contexts, and generated lively discussions with our growing community. But more importantly, you will have walked away with more thoughts, ideas about further research and implementations of usable security into ML systems for mental health contexts. But before we get there, we need to briefly examine the history and context of security, usability, and of course, usable security, and why it's important. And then we will move on to discuss why usable security is particularly different, difficult, and complex in machine learning systems built for mental health use cases. And then we will discuss our four-pillar framework, in which we presented in the hope to help guide new solutions to this complex problem with usable security and to evaluate existing solutions and to improve upon them. And then we will briefly discuss some specific examples on how those four pillars interact with each other and how their dynamics are guiding the development and use of usable security in such systems. And then we will do the recap, and we will finally deliver the promised About Us section. Well, I think these are the goals of what our talk is intended to achieve today, and hopefully by the end, you will have a growing awareness and have an ongoing discussion, and of course, have some ideas and thoughts about further research and implementations. Okay, well, let's move on to discuss why security and usability are extremely tricky and important. In the foundational framework laid out by security pioneers in the mid-1970s, there is this very important criteria that's called psychological acceptability, which basically translates to usability in our context. But it was not until more than 20 years later, around the 1990s, did the problem of usable security start to surface in the security community, when people started to realize, well, lots of the security mechanisms we have built to ensure that the system is secure actually cannot be navigated correctly and be used correctly by tech-savvy generalists, and that is a big problem. Well, this is how the concept of usable security is born and has been a research discipline since then. Well, when we're talking about usable security, we need to talk about usability too, because eventually the systems interact with human beings, and we need to think about how human beings can use such systems. Fortunately, International Standards Organization put out a good definition here, and I'll just let you read it here. Alright, it's very well that we have such a specific definition for usability on systems that interact with human beings, but things get a little bit more complex in machine learning systems. Well, if you could recall a rather infamous chatbot incident featuring Microsoft and a teenage girl personality chatbot called Tay on Twitter, I think that is rather obvious, and add on to the security problem of ML systems with all the growing evidence and research about how machine learning systems can be attacked and hacked. And I think it's very obvious that we need security for machine learning systems. But if we add on another layer, that is machine learning systems built and used in mental health use cases, the problem with usable security gets even more complex. Well, because it is a machine learning system, it is a system that interacts with humans and with a specific use case that involves a lot more stakeholders with a lot more diverse needs. And we will see in the next slide how that is true. And then we will move on to address how we can resolve this usable security problem and evaluate and assess current solutions. The more complex in ML systems for mental health than it is in general human-facing interactive systems. Well, here you will see two charts. The bottom chart just shows how security mechanisms are designed and deployed. Well, in a general purpose human-facing interaction systems, there are security engineers who are the builders of the system, and there are users whom, under a general, straightforward user model, can be described as a fairly general population with a rather cohesive or uniform courses of actions and predictable desires and needs of what they want from the systems and security mechanisms. Therefore, security engineers are building on these user models to design, deploy, and evaluate their security designs and mechanisms into the systems that they're building. But in ML systems for mental health, there are not only just two stakeholders on each side. Well, for example, on the builder's side, you will see ML practitioners popping into the picture. And guess what? What ML practitioners want to build into the system and want the system to do can be rather different from what security engineers want to build into the system and want the system to be able to do. And on the user side, there are more diverse user groups. For example, there are patients, providers, other caregivers to the patients, and policymakers in the picture. And each of those groups of users have rather different goals, actions, and desires that they want to perform through the system. Well, you ask why this poses a challenge to usable security. Well, here's an example. Let's say there is an ML system that is designed to facilitate conversations and therapy processes with patients. And sometimes the patients may want to dedicate the use of such system to their caregivers, right? Let's say the security mechanism you implement is a password-based system, right? Sounds straightforward enough, right? But here comes the question. How are you going to make the security usable and compliant in this process? Well, because if you are based in the United States, based on the Computer Fraud and Abuse Act, sharing a password, even voluntarily sharing one, counts as unauthorized access. So, what are the security engineers going to do about this? Would they implement a password-based security mechanism and write the security policies in such a way that would put other caregivers of the patients in trouble, right? So that will inevitably tangles the policymakers into the picture. And there are simply more dimensions to consider and more diverse needs and demands from a lot more stakeholders to consider. And those stakeholders cannot be captured under straightforward user models where the users have rather uniform and cohesive needs and actions. Alright, here we have the problem. So how about the solutions? This is where our four-pillared framework comes in, which we present with an intent to, number one, hopefully guide and encourage usable security designs from the beginning of any ML systems in mental health, and to also evaluate and assess existing usable security mechanisms in machine learning systems in mental health. And there are four pillars. So from the design process, and we focus on the context. That basically just means we get ready. And then, of course, just knowing what we are going to problem we're going to tackle, what user groups we're going to model are not enough, and we need to get it to work. So that's where the functionality pillar comes in. But as we all know, right, people generally don't trust the technology, and machine learning is rather a black box which doesn't invite trust at all. And guess what? If you slap on unnavigatable security mechanisms on top of machine learning systems, things are just going to get worse. So we also propose trustworthiness criteria for things to scale. And then, of course, nothing ever runs smoothly forever. Therefore, we also suggest a recovery mechanism to get things back on track in case of any security incidents. But of course, none of those pillars stand alone. They interact with each other. There are interdependence properties, there are trade-offs. Further details of these 4 pillars and 16 sub-properties and attributes are in our writing, and we also articulated their interactive relationships with each other. Therefore, we sincerely invite you to give us your further thoughts and feedback, and hopefully we can ignite some further collaboration efforts in both research and implementations on this usable security front for machine learning systems in mental health. Well, you may think that 4 pillars and 16 properties just for an initial proposal about the usable security issue for machine learning systems in mental health may seem a little bit excessive, right? I will walk you through some examples to showcase that not only these 4 pillars are probably just a scratch in the surface of the issue of usable security for machine learning systems in mental health, and more importantly, how their interactive relationships between each other can play very important roles in not only building, but also evaluating and assessing usable security mechanisms in machine learning systems for mental health. So first, let's consider a chatbot providing conversational-based cognitive behavior therapy to young adults. Well, let's recall another rather famous chatbot incident. We have some considerations here now. Because the chatbot is widely available and exposed to a wider surface of attacks, we may need to consider functionality to be of a higher priority because it needs to provide services to a wider range of population, but also to defend against a wider range of attacks from more people as well. And because it faces wider ranges of attack, it might be wise to also put recovery processes on the agenda to a higher priority as well. But this prioritization may not hold necessarily true for personalized matching between providers and patients powered by machine learning algorithms. Instead, trustworthiness might be more important when we are considering such intimate and close-knit relationships between providers and patients. And I will leave the analysis of the second and the fourth example to the audience, and I'm really looking forward to hearing your thoughts and ideas about usable security in these 2 use cases. And of course, we can compare notes on that afterwards. But here, I think my main point is that we need to consider contexts that are a lot more complex and make decisions, sometimes difficult, about prioritizations and trade-offs about the usable security designs and mechanisms in machine learning systems for mental health, because those systems have vastly different use cases and their security mechanisms and profile can be very different from each other, especially given that we have a more diverse group of stakeholders in these systems. All right, here comes to our end, and I think we have reached our initial goal of raising awareness in our growing community to this overlooked and complex issue of usable security in machine learning systems for mental health. And we have also shared, albeit briefly, our framework of 4 major categories to evaluate and guide the design and building and development of usable security in ML systems for mental health. And again, we sincerely invite you to critique our writing and give us your valued feedback. Now, of course, we also briefly presented tangible use cases of usable security in machine learning systems for mental health with more diverse security profiles and needs for usable security designs. So here's my question of the day to you. So what is your takeaway? What are your new thoughts and ideas you have come up? What are the discussions you have had with our community about further research and implementation of usable security in mental health? Here comes the promised About Us section. This is Helen Jiang presenting here on behalf of both myself and my collaborator Erwen. I am affiliated with Georgia Institute of Technology and University of Iowa, and my primary areas of interest are cybersecurity and practical applications of AI, while Erwen is more intensely interested in general AI/ML topics as well as mental health and just about anything related to human psychology in general. We sincerely welcome you reaching out to us because we look forward to your feedback, suggestions, thoughts, ideas, critiques, and potential collaborations on this complex issue of vast potentials and opportunities in practical applications. We look forward to seeing our growing community working on more research and the implementations related to usable security in ML systems for mental health, so we can better serve a wide population who deserves more secure and more user-friendly interactive systems for the mental well-being of themselves, or their patients, or their loved ones, or their communities of citizens. Again, this is Helen presenting the talk, Usable Security for Machine Learning Systems in Mental Health, a Framework, at Designing AI in Support of Good Mental Health workshop at KDD 2020. I'm here on behalf of both myself and my collaborator Erwen. We salute you for your time and attention, and look forward to seeing your work on this topic in the future.